lead P&A for Somerset NHS Trust, and I've been in post since January 2022. My background is in critical care, and I was on the first cohort of P&As at Plymouth University, the first cohort that was offered to critical care nurses. And I could really see the positive effect this could have on our colleagues. So once I'd finished the course, I started to develop the P&A role locally. And then when the lead role was advertised, I was successful at interview. So that's how I came to be in post. The course, I could really see the positive effect this could have on our colleagues coming out of the last wave of COVID. And getting the trust-wide post allowed me to influence trust-wide and not just locally. It's quite a diverse trust. There's acute hospitals, there's community settings, and there's mental health. So quite a diverse community of colleagues, and also spread across a wide geographical area. So quite challenging. But being in the trust-wide lead post gave me the opportunity to really start recruiting P&As across all areas, in all directorates, across all departments, to really spread the influence of the P&A and the positive effects of the role. We quite quickly started to come together every month to sort of keep that support going between us and to form a community of P&As within Somerset. So we established a community of practice. We meet monthly on Teams, but we also do face-to-face events twice a year so that we can all come together as a P&A group face-to-face and support each other, share good practice, develop, and also plan for the future. Started collecting feedback as well quite earlier on, because we realised that data is important and it has a big influence. So we collect quantitative and qualitative data, and we've also done an evaluation of the P&A role across the trust, and are able to share the results of that, and sharing especially the qualitative data, the comments people make about the effect that it's had on them, and seeing that transformation in staff is really powerful. And that's what we're able to share across the trust with leads and with the P&As themselves. We've been able to get a shift a month for our P&As with support from our lead nurse. Hayley Peters has been very supportive of the role, because again, she can really see the positive effects that this is going to have on staff. Positive impact it's had across the trust, and it's been a real ripple effect as you've seen the P&As themselves develop and the P&As develop their skills. You can see their influence widening across the directorates and departments, and having that real transformational effect on the staff that they're working with. But we've also tried to bring the P&As working in the trust together and keeping them together, keep them learning from each other, keep supporting each other, keep developing them, and also bringing the trainee P&As into that community quite early so that they feel supported during their journey, getting through that P&A module and finding the magic of the P&A role. I think some of the feedback that we've had from the evaluation forms, it is all about restoring staff, revitalising staff, helping them to find the joy in their work, and also moving forward and being able to move on, move up, move across, but definitely taking them away from being stuck and giving them the tools they need to move forward and move on. And yes, we've got that from the quantitative data and the qualitative data as well that we've been collecting. Inquiries come through me. So we've almost devised a checklist of steps to follow if you want to start your P&A journey. So that really helps colleagues to think about what it is they're taking on, and also to make sure that it's right for them. So it starts with doing our in-house clinical supervision workshop, which talks about restorative clinical supervision. We get them to complete the e-learning for health module on the NHS website, which gives a real good understanding of all aspects of the role. We get them to have that initial discussion with their line manager about the study days, because they're fully supported with the 10 study days, but also about that shift a month when they've completed. And we want them to do that because we want them to really start engaging with their line managers about the role, what it's about and what it involves. And then they get to fill in their expression of interest. We get them to make contact with the library to make sure their Athens is up to date, to make sure they know what services our library colleagues can offer, because they can be a great source of support. And then once they've got their place, we try and give them a buddy that's been through the same university. That's not always possible because the trust is so diverse. Sometimes geography is more important than the same academic assessment, but we do the best we can. And then we invite them to the monthly meetings. They get access to all the resources that we've got on various shared platforms. So we're right from the beginning of their application, we're bringing them into that trust P&A community to support them and get them through the module, and then join us as qualified P&As when they've finished. Sustainability of the role has been there from day one, really, because we want this embedded across the whole trust. We want it in all directorates and departments. So we do need to increase the numbers so that we can increase the influence, so we can increase the effect that the P&As have. And I think part of that has been supporting the P&As and keeping them engaged, making sure that we're sharing the practice, the good practice across the trust, and making sure that the P&As have got ways to develop their skills. So I think having the support of our chief nurse for the shift a month as well is crucial, because then P&As really get the opportunity to practice their skills and to make a difference for their colleagues. And it does need energy and passion to maintain that momentum. But if you're bringing the P&As together to keep that going, to keep each other inspired, then I know the funding is from NHS England at the moment, but I think it will be self-sustaining because that community will keep growing and keep doing. And I think if they keep doing, then we will be able to continue it within the trust. I don't think it's going to fade away. It's too good. Sources of funding, obviously having access to so many places has really been transformational in being able to get P&As practically everywhere. And when it comes down, if it comes down to local funding, that might not be quite so easy, and it will be in competition with all the other university modules that are available and all the other development and courses that people want to go on. But if it's seen as worthwhile, then it will be up there competing with those equal value. Reaching out to the national P&A community is a way forward, is a real way to develop your own service, because especially on NHS Futures, a lot of lead P&As are on there, a lot of P&As are on there. If you put a comment or a communication out there, you get a wave of information back. You get a wave of people happy to make contact, happy to share what they're doing. And I've done a lot of connecting through that site. People have contacted me about what I'm doing, and I've contacted other people about what they're doing and seeing if I can apply that to our organisation. So that would be the starting place. joining the webinars, the P&A webinars. There was one yesterday, and again, it's all about sharing good practice, seeing what everybody else is doing, but it also helps to maintain that momentum, maintain that energy and enthusiasm for the role and the positive effects that it can have. There's been 2 conferences this year as well, so attending events and connecting with people, sharing ideas, making contacts, and Twitter. That every day there is something on Twitter that will make you connect with another P&A or follow up in another direction. So that would be my advice. Connect with the people that are out there and doing and making inroads and starting to make a difference.